Namaste. Many of us may be unaware of the existence and function of an organ called the gallbladder. It's placed beneath the liver, so many a times cancer goes undetected until it reaches the last stages. As we observe Gallbladder and Bile Duct Cancer Awareness Month this February, it is vital to learn more about these cancers and be aware of its symptoms so that it can be diagnosed early. To understand more about it, we have with us Dr. Santhosh Anand KS, consultant surgical gastroenterology and minimally invasive GI and HPB surgery at Apollo Hospital's Greams Road, Chennai, to clarify all our concerns regarding gallbladder and bile duct cancers. Welcome to the FB Live, Doctor, and thank you so much for joining us.
Hello, madam.
What is a gallbladder, Doctor?
So, gallbladder is like a storage organ which is present beneath the liver. So, liver produces the bile. It comes through the tube from the liver into the intestines. So, in between somewhere in this tube comes like an outpouching called as gallbladder. So, that is closely associated with the liver and it has got few functions like storing and concentrating the bile. What is the necessity to store it? Whenever we take food, only then digestion is required. So bile will be required only at that time. Till then, it stores the bile. And again, liver produces slightly large amount of bile and it is being concentrated in the gallbladder. The second most important function of gallbladder is to prevent the formation of stones within it.
So, is the bile duct a part of the gallbladder, Doctor?
So both bile duct and gallbladder, we call this as extrahepatic biliary radicals. So I will explain you each and every term. Biliary radical means tube-like structure which collect bile from the liver and empty into the intestine. So it can be intrahepatic, means those which are present within the liver. So very small tubes collect bile from the liver and they join together to form a slightly bigger tube. And this bigger tube will be right side liver tube, left side liver tube, which comes outside the liver, joins together to form something called as a common tube or common bile duct. Small outpouching from this common bile duct will be the gallbladder. So, the tubes which are present outside the liver along with the gallbladder are called as extrahepatic biliary radical. Remember, gallbladder can be separated from this tube. So, it forms a portion of extrahepatic biliary radical, but it is not a portion of common bile duct.
Speaking about gallbladder cancer, Doctor, what are the causes of gallbladder cancer and is it more of a common incidence today?
So, regarding the causes of gallbladder cancer, first and foremost cause is presence of a stone, gallbladder stone, which is a big stone for more than 2 to 3 decades. And this occurs more in females and this occurs more in the sub-Himalayan or the Gangetic plain, like in states of Uttar Pradesh, Bihar, West Bengal, Bangladesh and Assam, which are slightly in the foothills of the Himalayan region where the Ganga goes. This could be due to ethnicity or this could be due to the water. The reasons are not yet identified. The other common causes include small anatomical changes in the way in which the bile empties into the intestine. It is called as abnormal biliary duct junction. Like how it joins with the intestine, it is different. Something reflexes from the intestine into the gallbladder and that can cause gallbladder cancer. Lifestyle changes, obesity, smoking, excessive alcoholism, all these are these days rapidly increasing causes for gallbladder cancer.
You mentioned about stone formation for over a decade. Does it show any symptoms, or rather, does gallbladder cancer actually show any symptoms? If yes, what are they?
So, gallbladder cancer is a slightly aggressive type of cancer. So, each and every organ of the body can turn into a cancerous tissue. Few organs, even if they develop cancers, they tend to be slightly better, but by and large, gallbladder cancers are usually aggressive. So, for example, if they start to develop a cancer within gallbladder, they can progress into an advanced stage within months, not in years. So, in early stages, if he or she has a stone within, they can present with pain, particularly in the right side of the abdomen, which is spreading to the back or to the right shoulders. Or since gallbladder secretes or empties the stored bile into the intestine when we take fatty food, that can be hampered by the presence of stone. So after taking fatty food, we will feel something dyspeptic symptoms like discomfort in the upper abdomen, indigestion, all those symptoms can occur. This can progress into a constant pain if the gallbladder is turning into be cancerous. In advanced stages, patient can have severe back pain, vomiting, and jaundice. Like any other cancer, gallbladder cancer can also present with loss of appetite or decreased hunger and loss of weight.
Is this gradually over a period of time, or is it sudden decrease in weight loss, which is very evident?
So whenever we talk about weight loss in cancers, so this is called as cancer cachexia, means the body is failing to thrive, failing to gain weight or failing to maintain weight. So this is usually called as unexplained or unintentional weight loss. So intentional weight loss means, say for example, I feel I'm overweight, I'm doing dieting, I'm doing workout to lose weight. This is called as intentional weight loss. But the other way around, I don't have any intention to lose weight, I'm not in diet or I'm not doing any exercise or workout to lose weight, but still I'm losing my weight means it is unintentional weight loss. Usually in gallbladder cancer, this unintentional weight loss can happen within weeks since it's an aggressive cancer.
Doctor, what happens to the gallbladder when the tumor starts growing on it?
So gradually, like any other organ, gallbladder, when tumor develops within it, it will be slowly replaced by the cancerous cells. And like the nature of cancer, it will spread like a crab. The word cancer itself means crab. Okay, so the adjacent organs, most importantly, can spread into the liver, it can spread into the intestines directly, and it can spread through small blood vessels and something called as lymph nodes. So these lymph nodes can be present in the stalk of the liver or behind the intestines, and through the blood it can spread into liver, lung, bones, and so on.
Doctor, you mentioned that females are or women are more prone to gallbladder cancer. Is there a particular reason?
So the hormone progesterone, which is secreted during a short period of time during every menstrual cycle and for months together during pregnancy. So what does this do? This reduces the motility of the gallbladder, means it reduces the ability of the gallbladder to empty. So whenever bile stays within the gallbladder for a prolonged period of time, so it overacts. As I told earlier, the function of gallbladder is to concentrate it. When it stays for a very long period, it over concentrates and slowly it forms sand. Sand can build up into stones. So this is one of the most important reasons why gallbladder stones and later cancers are common in female. So hormonal changes, some genetic changes are also there in female. So to the extent of 8 is to 1. For example, if I see 9 patients with gallbladder problem in OP, almost 8 people will be women.
And doctor, is it that people who have gallstones most of the time are more prone to developing gallbladder cancer?
So it is called as association rather than cause. So cause means, for example, hepatitis B virus infection, it has been proven to cause liver cancer. So association means like in most of the cancer patients, we find this also. So gallbladder stone is an association. If say we see 100 patients with gallbladder cancer, more than 95 patients we find stone within them. So they did a small study to find any association and risk factors of patients having gallstone to develop gallbladder cancer. They have narrowed down to like having a big stone, more than 1 centimeter stone, for a prolonged period of time, say 3 decades, and particularly if they are women from sub-Himalayan or the Gangetic plain, then definitely there is an increased risk associated with.
So, can kids also be prone to gallbladder cancer or bile duct cancer? If yes, what are the symptoms?
Gallbladder cancer by and large doesn't occur in kids. And bile duct cancers, yes, very rarely it can occur in children, particularly if they have something called as choledochal cyst. Choledochal cyst means the bile duct itself gets dilated, distended. See, the normal diameter of bile duct will be somewhere between 5 to 7 millimeters only. Due to some developmental or birth defects, this can swell into 2 centimeters or sometimes 4 centimeters also. So what happens, instead of acting like a tube, it starts acting like a bag, and bile accumulates there also without getting a free flow. So then it becomes a very good soil for cancerous cell to develop. So even in such cases, they develop only in their third decade, not in second decade. And symptoms like any other bile duct or gallbladder cancer, pain, jaundice, loss of appetite or less hunger, and loss of weight are the important symptoms in children also.
Does smoking increase the chances of developing gallbladder or bile duct cancer, doctor?
Definitely. Smoking, cigarettes or BDs, whatever, they have more than 100 or thousands of carcinogens. So carcinogens are the substances which can produce cancer. So as I said, they don't have one or two, they have hundreds or thousands of carcinogens. Not only lung cancer, not only food pipe cancer, it can even increase the incidence of gallbladder cancer, pancreatic cancer. So bile duct cancer and gallbladder cancer also increases with smoking.
We'll move on to talking about bile duct cancer in detail, doctor. What are the symptoms that our body shows if we have a bile duct cancer?
So whenever an organ develops a cancer, so symptom will be related to its function. So what is the function of the bile duct? The function of the bile duct is to just act like a tube, empty the bile which is produced in the liver into the intestine. So whenever it is blocked, something like a tube getting blocked. So the bile gets accumulated into the liver and it is not getting emptied freely into the intestines. So that can cause jaundice. So severe jaundice can produce something called as pruritus or itching. And patients will have pale color stools. The normal color of the stool is given by the bilirubin only. So whenever bilirubin doesn't enter into the intestines, then the stool color changes into pale or white color stool. Again, the urine color will increase a lot. Like their eyes turn to be yellow, urine becomes very dark. This is called as jaundice, along with pruritus. Pruritus means severe itching, like itching to an extent the patient is not able to sleep in the night. And sometimes they scratch so much that they will develop some abrasions or even bleeding from any part of their body. Along with this, like any other cancer, there will be decreased hunger and unintentional weight loss also.
So, what are the tests, doctor, that are used to diagnose gallbladder and bile duct cancers?
So tests we can classify into blood tests, imaging, and few invasive tests. So in blood test, first and foremost is the liver function test, which will show us whether the patient has jaundice or not, and if yes, what kind of jaundice it is. Okay, whether it is obstructive jaundice. Obstructive means bile is not getting emptied into the intestine due to obstruction. So that will be diagnosed or given an idea about with the liver function test. We have certain other tests called as CA99 and CEA or tumor markers. Like whenever these values are increased, then the likelihood of one having cancer is more. So these are the blood tests. Next is the imaging test. Usually done imaging test, like for example, if some patient presents to me with jaundice, we usually tell them to undergo a screening test called as ultrasound scan. That will tell us whether there is a block due to stone or block due to any other cause. And if we suspect cancer, then we will subject them to either a good CT scan or an MRI scan. And if we need to prove that, we may need to do an endoscope through which we can take tissue samples, or otherwise called as biopsy or brush samples, subject that for examination under microscopy, and then we can confirm it. To find whether it has spread throughout the body, like we know this is a cancer and we are suspecting like it's an advanced cancer, then we subject the patient to something called as PET scan. So this is a scan done from head to toes and will find where all the cancer has spread.
Doctor, when is surgery advised for these type of cancers?
So gallbladder cancer and bile duct cancers, traditionally the approach was nihilism. Nihilism means maybe some 30-40 years back, someone has gallbladder cancer, goes to a surgeon, okay, it's an advanced cancer. The prognosis is not good. Like whatever we do, patient is not going to improve. That has slowly changed over a period of time. This could be due to early diagnosis. This could also be due to advances in both anesthesia and surgical modalities. So in terms of stages of the disease, like any other cancer, stage 1 is very early, like even before developing symptoms, they are undergoing any master checkup, in that it was picked up. Stage 2 is patient started developing symptoms and the cancer is present only within the organ in which it develops, for example, only in the gallbladder. Stage 3, it has spread from gallbladder into the lymph nodes, and stage 4, it has spread into the other portion of the body. Now, stage 4, we are not going to do any surgery. Stage 1 and 2, definitely surgery is the main modality of treatment. So, stage 3, patient, majority of them, say 70 or 80 percentage of them, in which it has spread only to localized lymph nodes, not very distant lymph nodes. Surgery is the mainstay of treatment. In addition to that, we may need to give other treatment modalities like chemotherapy and radiotherapy also. I just repeat, stage 4, it has already spread to other portions of the body, and there surgery has got no role. 1, 2 and 3, yes, surgery is the main modality of treatment.
Doctor, what are the advances in the treatment options for gallbladder and bile duct cancer, doctor?
So in terms of treatment, we can divide it into surgeries and other modalities. Okay. So for surgery, one has to be fit for surgery. Earlier days, patient, if he or she had jaundice, they were doomed to be unresectable or not fit for surgery. Now these days, we have developed modalities through endoscopy or through radiological procedures in which small tube can be inserted into the bile duct and jaundice can be reduced, so that patient and liver becomes fit for surgery. So that is one advancement. Second advancement is, even a small portion of liver can be removed along with the gallbladder if it had spread. And along with that, if it has spread into the bile duct, a small amount of bile duct can also be removed, and the continuity can be re-established by joining it to the intestines. And the recent advances is both laparoscopy and robo can be safely done in gallbladder cancers, provided they have been identified in the early stage, say 1, 2 and 3. So the other treatment modalities like chemotherapy and radiotherapy, yes, earlier we had 1 or 2 chemotherapy options only which had huge side effects. Now definitely we have advances in latest chemotherapy modalities also, which has decreased side effects with better survival outcomes. And radiotherapy earlier, for example, only a small portion of body requires radiotherapy. Earlier radiotherapy used to give radiation to a larger portion of body. Now we have modalities in which we can concentrate into a very small portion without radiation effects on the surrounding portions.
What are the coping methods to deal with these type of cancers, doctor, be it physical or mental?
So first and foremost, one should understand that he or she has developed cancer. It will be very easy for me to explain, but empathetically, if I imagine from their situation, they can think, why me? And why at this situation I have got so much responsibilities? And fortunately or unfortunately, I don't have any ill habits, even though I have developed this. So, mental health should be stable. For that, doctor counseling and family and social support is utmost required. And second thing, we ourselves as doctors, what we do is we counsel the patients, like even though he or she has developed cancer, these days we have so much treatment options available, and if it is diagnosed at an early stage, we can give a reasonable life expectancy also with the recent treatment options and with decreased side effects. So physically, one needs to undergo a treatment as suggested by the physician or surgeon and cooperate with them. So that will take care of the physical portion, but the mental portion, yes, doctors, family, and the society has got a responsibility to support them mentally.
Doctor, why is laparoscopy or robotic surgery mostly not advised in treatment of cancer of the gallbladder?
So that was the thought a decade back. So earlier, see, like any other science, laparoscopy and robo is also evolving. Maybe 30 years back, no one was doing laparoscopy and robo. Then slowly came, and the first and foremost surgery which was done was removal of appendix, and the next laparoscopic surgery done was the removal of gallbladder. And that was for removal of gallbladder. Indication was stone, not cancer. But for this to get extrapolated or grow to an extent to remove for gallbladder cancer also, it took almost 2 to 2.5 decades. Now what happened initially, there were fear of spread of cancer tissues through the small holes through which we insert the instruments and do surgery. Now we have developed all precautionary mechanisms to prevent these spread into the small holes. And also we have advancements in the energy devices, advancements in the optics. Like my hand will be 4 times bigger if I see through the laparoscopy. So even a small tissue which can be appearing small to my eyes will appear very big in laparoscopy, and the chances of me leaving that comes down. So even a small tissue, cancer tissue, can be safely removed. At the same time, recent mechanisms have shown to prevent spread of these cancer tissues into the holes also. And advantages, definitely like any other surgery, laparoscopy and robo, the patient recovery is earlier, patient can get back to work earlier, pain is less, infection is less, chances of developing hernia through the incision in which we used to do open surgery is very less, without compromise in the removal of the cancer tissues. We in Apollo Hospital regularly do laparoscopic and robotic surgeries for stage 1, 2 and 3 gallbladder cancers and bile duct cancers also, with very good results.
We'll take some questions from our viewers, doctor.
Yes.
I was diagnosed with liver cirrhosis and I'm now undergoing treatment. I've read that cirrhosis increases the chances of getting bile duct cancer. Is it true? How do I know that? And what are the preventive measures that I should take?
So it's a very good question, but cirrhosis per se increases the chances of cancer in the liver. So when I say liver, we can just imagine like a tree. A tree will have a stalk on which leaves will be there. So leaves are similar to liver tissue and stalks are similar to bile duct tissues. So the stalks do not have risk of developing cancer and cirrhosis, whereas the leaves have risk of developing cancer and cirrhosis. So the primary liver cancer, yes, there is an increased risk, but bile duct cancer, particularly extrahepatic, those tubes which are present outside the liver, the risk of cancer doesn't increases. Liver and intrahepatic bile duct, those stalks which are surrounded by the leaves and the leaves. So the liver along with the intrahepatic biliary radicals have increased risk of developing cancer and cirrhosis.
My mom has been diagnosed with stage 2 gallbladder cancer recently. Will it be necessary for her to undergo a complete removal of the gallbladder?
So it's a very good question. So far we were discussing about surgery, but we didn't discuss in detail regarding the same. So in gallbladder cancer, we don't remove the gallbladder alone. We will be removing a small portion of liver, say 5 to 10 percentage of the liver. Along with that, we will be removing the probable areas of lymph node spread, like in the stalk of the liver and behind the pancreas also. So removal of gallbladder, a small portion of the liver, along with that lymph nodal tissues forms the complete surgery for a gallbladder cancer.
I am 36 years old and I had jaundice with pain in my belly and light colored stools. We conducted an ultrasound and recently found out some polyps in my gallbladder. How do I know if they are cancerous or not?
So gallbladder polyps can be cancerous and non-cancerous. So what are the risk factors for that being a cancer? If a polyp is more than 1 centimeter, if it is a single polyp, and if we are doing serial ultrasound, means I got an ultrasound done 6 months back, now I am getting a repeat ultrasound done. In this, we are seeing the increase in size of the polyp. All these are risk factors of this polyp turning into a cancer. At the same time, the other way around, there are multiple polyps, small polyps, less than a centimeter or 3 to 4 millimeters. It is not associated with the stone. All these are benign polyps. Benign means non-cancerous polyps. Coming to your condition in which you have developed jaundice along with light stools, having a polyp, it's better for you to undergo a contrast CT scan of the abdomen. If required, an MRI scan also, along with few other blood tests like tumor markers, to find whether that polyp could be cancerous and it has spread outside or not.
I got diagnosed with bile duct cancer last week, and my healthcare provider thinks that I should undergo chemotherapy. How effective is chemotherapy, and is it done through shots or pills?
So, like any other cancers, initial stage of solid organ cancers, treatment modality of choice is surgery. But if it is in slightly advanced stage, surgery has no role because it has spread to other organs also. In that situation, we may need to control the growth of cancer throughout the body, which is taken care by chemotherapy. So chemotherapy usually is given after reduction of the jaundice. So either endoscopically or through some radiological procedures, your jaundice will be reduced first, and then you will be subjected to injections only. So pill chemotherapy is only a portion of chemotherapy, but definitely you will require, in addition to that, injections which will be given in cycles. Say you may get admitted for a day or two in cycle, which will be once in 21 days or once in 28 days. Like that, 6 to 8 cycles may be required.
I am a 46-year-old female diagnosed with gallbladder cancer. My doctor has suggested performing immunotherapy on me. What are the other treatment options available, doctor?
So immunotherapy, just like chemotherapy, is given only in advanced stages, maybe stage 4. So immunotherapy usually is the advancement in the recent chemotherapy. It acts directly on the cancer tissues of the gallbladder alone. So we do some special tests through the biopsy, like small tissues which has been taken from the cancerous cells. They are subjected to find whether this immunotherapy will act on your body. If they turn out to be positive, then it's good for you. Though it is advanced, this particular immunotherapy will directly act on the particular cancer cells with very less side effect on the remaining organs. So immunotherapy is the recent advancement in the medical oncology portion of bile duct and gallbladder cancer management.
What would be your message to our viewers, doctor?
So in this gallbladder and bile duct cancer awareness month, if you have a small doubt of having jaundice, me being from a place where people have a thought that whenever we have jaundice, we should go for a native treatment. So even a small child or an elderly men or women, if they develop jaundice, they go for native treatment initially. And after 2 to 3 weeks, if the jaundice doesn't come down, then they come to us. By that time, whatever the cause of jaundice, it could be viral, it could be due to a stone, or it could be due to a cancer, rarely, that would have progressed. So I am not against native treatment, but try to find what is the cause of cancer. Get yourselves tested with blood test and ultrasound scan. If it is viral, definitely supportive management is enough for the treatment of viral hepatitis, which is the most common cause of jaundice. In that way, native treatment also doesn't cause any side effect. Unfortunately, if your jaundice is due to stone or a cancer, native treatment is not going to help you out. It is only going to delay the treatment process, and when you present to a doctor, you will be either having severe jaundice along with infection, or the cancer would have spread into other organs. So, if you have jaundice, get yourselves tested with blood test and ultrasound scan. Don't hesitate. Having heard that I have cancer, we have treatment modalities both laparoscopically and robotically, and if it is advanced, we have advanced chemotherapy and immunotherapy to tackle them also. So get yourselves diagnosed first properly, take appropriate treatment modalities. Yes, we have good treatment opportunities for both bile duct and gallbladder cancer these days.
Thank you very much, doctor, for an insightful session on all we needed to know about gallbladder and bile duct cancer. For appointments with Dr. Santhosh Anand KS, consultant surgical gastroenterology and minimally invasive GI and HPB surgery, Apollo Hospitals, Greams Road, Chennai, please call 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctor.
Thank you.
Thank you, viewers.